Hello and welcome to the Healthtech Marketing Show. I'm your host, Adam Chirinas. I'm the CEO of Health Launchpad. We specialize in healthcare technology marketing, especially account-based marketing. And I also want to give a big thank you to HIMS and a big thank you to you for listening. I know we have several folks who listen quite frequently. So if you're out there, Heather Lodge, hello. Thanks for saying some nice things about the podcast the other day. So today we're going to talk about a topic that I've known about for a while, but to be honest, I haven't ever practiced it. And it's an area that we've never really covered or touched on in the series. And it's the whole area of B2B2C. And to help me with this, I'm joined by a member of the Healthtech Marketing Network. This is a private network for senior healthtech marketing leaders that we run. You can find out more about that through the website, healthlaunchpad.com. And it's the awesome Bonni DeWoskin. So Bonni, hi, welcome to the show.
Hi, it's great to be here. Thank you, Adam.
Good. So tell us a bit about yourself. Now you're a fractional CMO, right? So I think people are vaguely familiar with that, but tell me about, what your background and how you kind of shifted into being a fractional CMO.
Sure. So I am, a health tech marketer. I've been doing it for, I hate to say it, 25 plus years, maybe more than that. I've been saying 25 years for a really long time. So
you must have been a teenager when you started.
Well, thank you. And really in the, B2B, B2C, and then this B2B2C space. And I, leading companies, helping them through growth. And, most recently, I started seeing, hearing about fractional a little bit, I think like a lot of people out there. And I started researching it. And at the same time, I'm very much in the health tech, age tech, caregiving space. That's where my passion is. I live it as well. I recently moved my mom in with me and I have a young son. So I'm in the sandwich generation. So my personal life is pulling me at the same time that I'm working full time as a chief marketing officer for high growth, fast moving companies. And I'm learning more about fractional, and I'm working for these high growth health techs that don't have a lot of budget, and every dollar is so meaningful. And as I'm learning more about fractional, I'm realizing, a lot of these dollars could be saved by going with fractional leadership, and then companies can put more of those dollars in the actions that are going to have return in the marketing spend. And so I left the corporate world and to spend time with my family and to build my own company, CMO Scout, which is this fractional leadership. And, one of the ways, if you think about it from this healthcare, health tech CEO perspective, you're at the helm of this burgeoning health tech startup. You've got this innovative product. It's changing the status quo, making things better, more efficient, more accessible. And you're at this point where you realize you need to bring in experienced marketing leadership. You've probably been doing a lot of marketing, making big investments, but still struggling to stand out and grab attention in this incredibly crowded and noisy market. And, at the same time, the budget is tight and every dollar needs to be spent wisely. And that's where I come in now, to transform and to help build without spending, a ton of money. And the way I've come to look at it recently, there's software as a service, it's leadership as a service, right? You bring in this guidance. It's like a subscription, like an Uber, like what Uber did for transportation, or Netflix. It's a subscription-based service, and you can bring in the expertise you need when you need it without this full-time commitment. And I was fortunate. I was able to write an article just last week. And Adam, I'll send it to you, in WorkSpan Daily, which is World at Work. It's their publication for HR and total rewards professionals. And I was able to talk about this topic, and I love to speak about it and talk about it, as you'll probably see in this next 30 minutes or
It's
so.
good. Yeah, it's funny. I mean, when I started Health Launchpad, I actually, initially it was doing project works and doing fractional CMO work. And it morphed into becoming an agency because clients kept asking, well, can you help with this? Can you help with that? And so it just ended up sort of becoming that. We called it, we actually still call it marketing as a service. And the idea is, as you say, is that for early stage companies, initially it's where they've got seed money, they've got very little budget to spend on marketing. Having somebody like yourself or me in my former role as a fractional CMO as well, be able to make a real impact, both in terms of the strategy and then execute. You get a lot of leverage, and then you can scale it up. So I agree with you. I think it works really well. It meets the need, and also it's a lot of fun. I mean, I think the difference between being a fractional CMO and running an agency is, I think with fractional CMO, you are really at the table with the CEO and the founders of the company. And I don't think in an agency, particularly when we're working with much bigger companies, publicly traded companies in some cases, that you'll really, you get that kind of, that kind of visibility and that kind of, ability to impact, shape the strategy. So I think it is a lot. I've really enjoyed doing it, and I'm glad to see you're doing it too. So let's talk about B2B2C. Yes, I did get it right. B2B2C. So what is it? And why do we want to talk? Why do we think it's something that people should know something about?
So I love this question because I love B2B2C marketing. And the best way to describe it is you're marketing and selling into a business channel, so a company, and then you're using that channel to market and sell into their user base. So a company has a platform, right? It's a health tech company. They have a platform, and you need to get users onto the platform. So first they have to sell to the organization to say, yes, we want to do business with you. Then you have to sell and market it's a whole nother sales process where you now have to sell and market to the users to get them engaged into the platform. Or, I spent a lot of years working in, the wellness, chronic care management, disease management.
Yes.
So it's very similar, right? We had to sell into either the health system, the employer, the health plan. We get them to sign a contract, but you need people to use the service, right? You need people to opt in to say, yes, I need your product. And that's, it's hard, it's different, it's challenging. It's a whole different sales process now.
But isn't the to see part the responsibility of the customer? I mean, I used to run a software company selling communication software to health hospitals, and we do a bit to launch it, but after that, it's like, hey, it's up to you to get the users using it. Why as a service or a technology provider do you need to do the lifting to get the patients to adopt whatever it was that you sold in there?
Well, because ultimately it's your responsibility, it's your business. So if you don't take that responsibility, think about, I'll think about it from one of the most recent companies I worked with. It was a health tech, but it was sold into an employer as an employee benefit. Think about how many other employee benefits that employer has for their employees, right? They're not going to spend the amount of time that you're going to spend trying to get those employees to opt into your benefit over the others, right? And if they don't, is the employer going to sign up with you again next year if nobody opts in? Same thing with the platform. If nobody uses it, how happy is your customer, your B2B customer, going to be in a year or whenever you do your QBR and they're looking at all of their expense? Are they going to sign up with you again if nobody is using your product?
Yeah.
And you're leaving your success to them. You're not taking control of it.
That's a great example, and explains explains it very clearly. I guess what I take away from that is, if your revenue model is based on user usage, so ultimate end user usage, then you have to take the incentive. And if you run more of an enterprise software company, so my company was enterprise SaaS, and it was based on a number of physician users or provider users. It was provider to provider communications, not provider to patient communications. We would sell it in blocks of 1,000, and it's use it or lose it. And so while we would need to provide some guidance to them and get the product launched, after that it was down to them. What you're describing is a model where, as the vendor, you get paid based on whether the end user actually uses the product or the service at all, right?
It can really be either way. But ultimately, you look at it as, an investment in your client, right? If the client isn't happy, so whether your model is to get paid or not by the users, if nobody's using it, are they going to keep working with you, right?
Yes. Yeah.
And so it's looking at it as an investment into client retention from the B2B perspective.
Yeah, I mean, that makes a lot of sense. What are some of the strategies and tactics that you use in B2B2C that's different from B2B or B2C, for that matter?
Some of it, some of the strategies are the same, right? You're just using them both together. But the biggest one is thinking about it, I guess, two ways. Number one is you need to look at it as an entire journey. I've seen a lot of people look at it as, oh, it's my B2B and it's my B2C, and not looking at it as an entire one journey. But so this integrated customer journey, I think, is one. I think another is really your B2B is a channel, right? And you need to really leverage that channel. You need to engage them. You need to leverage them to help you get to that end user.
Them being your customer.
Yes, your B2B customer. So the business, the enterprise that you're selling into, they are now your channel. The sale doesn't end when you sign a contract when you're in B2B2C. It keeps going, because now you have a whole new sales process, but it goes through. It's different than regular B2C because you're using the employer or the business that you sold into, whether it's a health plan, a health system, an employer. They are now your channel to help you get their end users to engaged. And one of the biggest learnings I have, one of the biggest takeaways I hope people take from this is, one of the best things you can do is get a super user, get a champion in that organization level, to use it and to help you, because people will listen to their peers. It's influencer marketing. They're going to listen to their peers more than they're going to listen to, you as a company or a marketer.
Give me an example of that.
Again, using one of my most recent companies, a client where it's a employee benefit that they're selling in, and it's a platform that people then need to sign up for. The people you're selling to are very different than the people who are then, working on engagement into the product. So taking one of those, whether it's an HR leader or whoever it is, having one of those use your product first, really understand it, and then having them be able to go out to their peers and to talk about it and to get people to use it, where it's not just relying on the outside marketing, but it's having an insider who's used it, who's in just when they're out to lunch with their peers talking about it. They have the experience and they can help promote it and get people to sign up and identify people who are, who need the service, depending on what it is, right? If it's a patient platform or a chronic condition or an employee benefit, they're going to know who the right people are for that product, and they're going to be able to help promote it internally.
I see. Yes. So get them to be a kind of like more of like an internal influencer. That makes a lot of sense. That's great. So let's talk about, you talked about budget early on. And so the budget issue here I find particularly interesting. So like, let's say you've got a marketing budget of $1 million a year, and you've got to have staff costs, your media costs, your agency costs, if you have agencies or consultants, whatever you use outside, and then tech costs. And so if you're B2B purely, you'll probably have a demand generation team. You'll do a lot of conferences. You might spend some money on LinkedIn advertising. You might do account-based marketing. Then from a tech standpoint, you've got your tech stack. You probably got your HubSpot, your Pardot, whatever. Maybe you've got demand-based or something like that. And there's never enough. If you do B2C, you're probably actually taking that $1 million and spending more of it on media to drive awareness. And so my question is like, in a B2B2C scenario, you've still got $1 million. How do you balance the budget then? Because you've still got salespeople are saying, hey, we need to be at this conference, and I need you to generate some leads. And at the same time, you've got a customer success team that's saying, we have 1 million users here across our customer database, and we need to get them using the product. How do you balance that?
Number one, I'd say you probably need a bigger budget for B2B2C because
that's an interesting point, right?
Yeah. Because you do have those two audiences, and usually there's different verticals. You have a leader, you have a chief marketing officer, a head of marketing, whether it's full-time or fractional. And then typically you'll have verticals under that where you'll have a B2B and a B2C vertical. So you have people responsible for engaging both of those audiences. Again, you need to look at them as one user journey, and you need to make sure the messaging to the B2B is also empathetic to the B2C and vice versa, because they see both messages. But they are two different marketing, verticals. And so you do need to split up that marketing pretty much evenly, if not more so to the B2C, because it's a longer term engagement. A lot of it can be through email marketing. I mean, there's not going to be account-based marketing and those investments for the B2C audience, but you might have more direct mail. People are at their homes, and you might have to communicate with them to their homes. A lot of times, if you're going through a health plan, they don't have email addresses. It's improving, but a lot of times they don't have email addresses. Sometimes they may not even have permission to market to them. But if they do, it's direct mail is going to be the best. They might not be able to, they don't have phone numbers sometimes. So it has to be direct mail. That's expensive, right? So you definitely, budget is a key concern, and probably need more of it for the B2C side than the B2B side. So I would say $1 million.
What would you say
in that case?
And what would you say? Would you just say, look, if you're a B2B company and for whatever reason you're offering a new service line that means that you're going B2B2C, do you need to then double your marketing budget?
I would start. I don't think you need to double it. It depends, it depends on how efficient you are with your marketing, but I would say at least, probably a significant increase and a shift.
Maybe 50. Okay. So let's say maybe 50%. What do you mean in terms of a shift?
To maybe shift some of the efforts you were doing to B2B and move those to B2C. So get more efficient with your B2B marketing, maybe spend a little bit less with your B2B marketing and move some of it to B2C. Or as you said, kind of that 50%.
And in terms of tech, let's say you're using, say you're using HubSpot, and you're using HubSpot and your B2B side of things. Can you use HubSpot for your B2C side of things?
So potentially, I would say I love HubSpot. I use HubSpot for my own marketing as well, but HubSpot, as far as I know right now, is not HIPAA compliant. So it depends.
I think they announced that it was. I think they made an announcement in the last month that they are. For what it's worth.
Okay. Well,
Yeah.
if they are, then that is one thing that you just need to pay attention to and make sure that whatever, if you are communicating to patients and or through a health plan, and HIPAA compliance is something that you need to pay attention to, then you just need to make sure whatever platforms you're using are HIPAA compliant. If HubSpot is now, that's amazing. That's great. And then yes, you could continue to use HubSpot. You just need to make sure that your CRMs, your marketing automation, everything, your audiences are designated as the B2B versus the B2C audience. So when you're and segment that out. So when you're doing your campaigns, you're going to have different campaigns, different messaging for B2B versus B2C.
Got it. That makes a lot of sense. I'd love to hear some stories about, some challenges that you faced in your life doing B2B2C and how you overcame them.
I think, early on, biggest challenges is making the mistake of looking at it as two separate events, two separate, journeys. When I came in, first time leading marketing on doing it, I will admit, I looked at it like, oh, I've done B2C, I've done B2B, this is piece of cake, right? And looking at them as two different journeys, and you can't do that because it really is one journey, and you really do have to leverage that B2B channel as much as you can. So in one company, we actually created, built a whole platform and made the company kind of B2B2C more so than it was. And so we had to shift, we had to learn on the fly about how do we really get people engaged into the platform. And it took a while. There's a lot, with a lot of everything, there's a lot of A/B testing, a lot of, test and learn. And sometimes, you have to be really careful that your messaging to one audience isn't offensive to the other. Right. So, and not offensive in like a horrible way, but offensive in that when you're messaging to employees, you have to make sure that whatever message, if it's in a employee audience, you have to make sure that message isn't going to turn off the employer who you sold into, right? Or it's the same thing as the health plan. If you're messaging to their members, you have to make sure that whatever you're messaging to them is, supportive of the health plan that's actually bringing you in and paying for your service.
Yes, yeah, right. Because although, I was thinking about the sort of client agency relationship, although you're the end customer is who you're trying to market to, you've still got to treat the person who bought the software or the service from you as the customer, as the client, right? Yeah. So that's very interesting. This notion of a continuum of a buyer journey that you've described here is very intriguing to me. I mean, I'm obsessed about the B2B buyer journey, and I know a lot about the consumer buyer journey because I spent decades in that space. But what's that? There's a sort of like a changeover point, right, where you get to the end of the customers onboarded and all that stuff, and then it becomes about the patient journey or the consumer journey. What's that transition? When you're sort of, do you have a tool for mapping this out? It sounds really interesting.
Yeah. So, I mean, one of the things I do is just this, it's a marketing systems map. And I do it for every client. And it's much messier for B2B2C because it really is, I build mine in Visio, and Visio has this great tool where you can embed it. You go into Excel and there's an add-on for Visio. So you can actually make a spreadsheet of all of your touch points, and then it will automatically process flow it out, which is so much easier than the whole manual where you have to like add a shape and then connect it all. But it makes it much easier.
Just pause a sec. So you start in Excel.
You start in
And then
Excel.
you set, oh yes, because I love Visio, but it is such a manual pain in the neck. And I see what you're talking. That's really interesting. Yeah.
Yeah. They have a template. It's an upgraded. It's
Yeah.
not the Visio that comes at 365. You have to pay a little bit more for it, but there's a template, and you just put all the steps in. You assign the shape, and it just automatically maps it all out. It makes it much easier.
Right. And so you can get really detailed. I mean, like how many steps? I mean, we try to simplify things in the B2B buyer journey to 3 or 4 steps.
Mm-hmm.
But if you're doing, a B2B2C journey, how many steps are there?
Well, so I actually look at it. I mean, you can map out the journey that way. I look at it more at touch points than necessarily journey from that way, right? So I look at it from the user experience perspective. So what are all the ways that a buyer or a user can come into your ecosystem? So if they come to your website, so if you're doing, I know you do too. I love intent-based, account-based marketing. I love all those tools. Somebody comes to your website and they look at your website, but they don't do anything, right? They leave. With certain tools, you still know who they are. You still know somebody came to your website and left. So it's like, okay, that's one way they came in. If they come into your website and they do this action, they don't do anything, then what is the journey there? What are you doing? So you'll retarget them with ads. So that's one leg of that. What if you also have their email address? Like, yes, you have their email address. Okay, well, I'm also going to send them an email. So I mean, like, hey, don't leave, or maybe you're not convinced, or some kind of email to go with that, and then maybe you'll put them into a nurture campaign. So mapping it all out, that way, and then they come to your website and they did watch your video. Then what do? You have their information. What's the flow from there? And so from the messaging standpoint, you need to look at the journey from the different phases they're in, but looking at it from the touch points really lets you dig in and think about it as from every single, touch point in this journey. And, I do a before and after. So when I come into a client, I do, what is it today? And a lot of times it's very linear. Somebody comes into the website, they do this. They do a webinar and here's what we do. And by the end, the future one, it's a mess, in a good way, because everything's all connected. Everyone's going through one. Eventually, everyone's being pushed to the same form, right? Or the same scheduler or something. And everything makes sense. And it's all looked at as this one journey. And for B2B2C, you're looking at it from, when somebody, initial touch point from a B2B perspective, all the way through to this end user. And
very interesting. Yeah. And I think what I especially like about that is that, we all tend to try and simplify things and make it linear. And that's like, let's face it, B2B buyers don't buy linearly. Then they're spending 13 plus months evaluating how to solve the problem that they're facing. And then you've got consumers or patients, and you're talking about a multi-year relationship with it. It's just not linear. And so I like that notion of starting with the touch points and figuring out kind of how to react to their interactions, as opposed to trying to push them through, which is, let's face it, it's not very often not very realistic.
Yeah.
Really,
well, you brought up a great point, and I know that's not the topic of this per se, because it's more just B2B, but they spend all this time, a company, a buyer spends a lot of time researching many times before they ever reach out to you, right?
Yeah.
I think we've all seen that research, that it could be, anywhere for 80% of the buying process, the decision's already made before anybody even reaches out to you, right? And that's where this, account-based marketing, this intent marketing why I love it so much. It really does help more on the B2B side, but more and more trying to figure out how do you leverage those same tools and that same mindset for the B2C side of it as well.
I really like the idea of that, but you're going from sort of a situation where you're talking about relatively small numbers of people, like hundreds or low thousands, to in a B2C situation a much higher number. Although I guess it's not with the way that you're describing B2C, it's a captive audience. So the C in B2C here is not millions, it may be thousands as well. So I think that is actually quite an interesting perspective, in that you actually can use some of the tools that you use for identifying intent can work just as well on the C side as on the B side. So that's I hadn't thought about that.
Yeah.
This has been a great conversation. As we wrap things up here, if you could give somebody who's thinking about going down this path, and maybe they're sort of doing B2B right now, and they're thinking about, should we extend out to do B2C for whatever business reasons? Maybe it's a new product. Maybe it's we have to do this because otherwise we're not going to be able to. We're going to lose more. We're going to lose customers. It's affecting our churn. What advice would you give somebody who's starting on this journey?
I think know what you're getting into, right? It is a different audience, and you just want to make sure that you truly understand who the audience is, what your objectives are, and from a marketer's perspective, again, it's not as easy as just understanding B2B and B2C, right? Because it's unique. From a business perspective, again, and I was just part of this accelerator program that AARP has, and there are a lot of companies going through that were B2C, and they've now realized, hey, we want to go B2B2C, right? They were selling directly to consumers, and now they're just starting to go to the employer because they want that channel, because that channel is helpful. But they run into the challenges of, you can't just say, oh, now we want to sell to the B2B audience. It should be easy, right? You have to make sure, just with everything else, understand your strategic plan, have a strategic plan, know your audience, know what your objectives are, really understand what you're trying to accomplish by going to this other audience, whether you're going from B2C to B2B2C, or you're going from B2B to B2B2C,
I'll make me follow that. But just one point on that. Do you think there are more companies that are going from B2C to selling to B than the other way around? Than are like, we're B2B company and now we need to sell to the end users?
I do, because I think B2B companies that are B2B2C, like from the company, if they started out that way, most times they've started out that way. In my experience,
I see. Yes, makes sense.
I think it's more of the B2C companies that are selling direct to consumer that are saying, this is hard, it's expensive, right? It's a huge audience. We can leverage our efforts and our dollars better by selling into B2B and having them using their channel to help sell to the B2C. So I do think it's more of that expansion.
That's great. Well, this has been very interesting. I've learned a lot. It's a topic I've kind of known about vaguely for a while, but I've really learned a lot from today. So, Bonni, thank you. How can people reach you if they want to reach out and talk to you about this?
Yeah, so my website is cmoscout.com. Feel free, or my email is bonnie@cmoscout.com. I think it's maybe a little obvious. I'm passionate. I love healthcare. I love, fractional. I love marketing. I love B2B2C. So I'd love to talk to anybody and everyone. Please reach out.
Great. And, you're a member of the Healthtech Marketing Network. Enjoy enjoyed getting to know you there, and you always contribute a lot. So it's been great. So
it's been fun. So thank you.
Excellent. If you're listening to this episode and you want to watch it, just go to healthlaunchpad.com and you'll find a blog post about this, and you'll be able to see the two of us having a chat about this. And if you happen to be on the blog post or on the video on YouTube watching this video and you want to subscribe, you can subscribe on any of the channels, right? Spotify, Apple, all of those guys. So lots more episodes coming up. Thank you to you for listening. Thank you to HIMSS for your support with this. And we'll see you on the next episode.